Hello, this week's video journal is supposed to be on transference, countertransference, prejudice, or biases. Um, there's one very specific example that stands out to me and does happen somewhat often with me, maybe not to this extreme, but there is a nurse that was in clinical, and she's a patient just in our office, our psychiatric behavioral health office in general. She's a nurse and has been, she's a nurse manager and has been for a very long time. And she has just a general problem with young nurses. She thinks that they're not educated well. She thinks that they're lazy, a whole host of other issues. She just doesn't like them. And she's pretty plain spoken about how she feels about it. She has a daughter that is actually a nurse, young nurse, but isn't actively practicing right now. She has small children. So how that relates to me is that this woman in particular is 10 years older than me. But I'm 44 and she's 54. And a lot of times people think that I'm a lot younger than I am. And so she just kind of associates me with this younger group of nurses. And even if I was 34 or 24, she just kind of puts me in that group. And so she had asked that I not be allowed to be in on her session, on her office visit when I was in clinicals, because she just doesn't like young nurses. And so she obviously doesn't approve of me going on to get my APN. So whatever feelings that she has, she transferred those over to me. And when she sees me in the office, just when I'm in there working in that capacity, she's, snarky, I guess, because she knows that she made her opinion clear as to how she felt. I think one day when she finds out actually how old I am, she will probably feel a little bit more uncomfortable about how that happened. With all that to say, that situation is a little bit extreme. However, I really don't think age should have anything to do with it, but I very often get people that make remarks about how young I am, I don't look old enough, so on and so forth. And whether or not that's true, I don't feel like that I should have to justify the fact that I am in graduate school at 44 years old. And I often find myself explaining myself and getting insecure in those scenarios. So I guess that would be my instance. And just how I've been able to handle that is just making sure that I am confident in my delivery, that I am well schooled in what it is that I'm talking about and how I approach subjects with my patients. And then just, moving forward with them. And, I've had quite a bit of life experience in my 44 years, but again, that's not something we're really allowed to even go into with our patients. And not to get personal, but sometimes I feel like if they only knew, it would probably maybe give me some credibility. However, I do feel often that I'm not given a fair shake. Because right out of the gate, I've been told on more times than I can count that I'm not old enough to be in the position that I'm in. So that is my experience, and I will just have to move forward with confidence in my education and just continuing to learn, which I do even outside of school right now. Constantly listen to podcasts, constantly watching educations, constantly listening and reading and trying to learn more, just so that I can be knowledgeable and so that I can have a clear conscience for what I'm practicing and doing for my patients. Thank you.